blueberries, blackberries, raspberries, strawberries. They're among some of the tastiest and healthiest fruits you can eat. And they benefit adults and children of all ages. Now, March is National Nutrition Month, and Dr. Ann Dudley with Spectrum Health's Culinary Medicine program, she's going to talk a little bit more about the benefits of these delicious superfoods and why you should keep a stash of them in your fridge. She also has a recipe, which I love, or maybe a couple of them to help you get you started on that path to better nutrition. Hey, thanks for joining us, Dr. Dudley. How are you this morning?
Thank you. I'm great. Good morning. Thanks for having me.
Absolutely. Let's talk about these superfoods. We hear a lot. I remember blueberries had quite the heyday for a while there. They were really, really popular. Why are these berries so nutritious? What makes a food a superfood?
So a superfood is, that term is sort of a marketing term, but basically it lets us know that a food has really high value. So it has a lot of nutrients packed in a small serving size. And berries certainly fit the bill here. We know that berries, such like you said, strawberries, blueberries, raspberries, blackberries, even cherries, they're all full of so many healthy nutrients called phytonutrients that really can help our bodies.
And is a certain berry good for a certain part of the body, or is it just antioxidants good for everything? Talk about that.
Yeah, so if we think about antioxidants, like you mentioned, that's a type of phytonutrient that will help get rid of some toxic oxygen particles in our body. If you think about a piece of metal rusting, we want to prevent that same similar type of process in our bodies. So taking in foods that have antioxidants will help reduce our risk of that oxidation process happening in our bodies. We know that this can help our brains, our hearts, even reduce blood sugar and blood pressure. So they're really beneficial for so many reasons.
Okay, Dr. Dudley, here's the deal. You've explained how good they are for us. We all know how tasty they are. Why is it so hard to get these into our diet every day? I mean, how much should we be getting into our diet?
That's a great question. We know that only about 1 in 10 of the average American is getting enough fruits and vegetables in their diet every day. So we all have a lot of room to improve, which is a hopeful thing, I think. So we all should be aiming for about 2 servings of fruit and 3 servings of vegetables, both in adults and in children. So I always tell my pediatric patients, aim for 5 a day, usually 2 fruits and 3 vegetables.
2 fruits, 3 vegetables sounds pretty simple. And of course, very important for a child's diet. But for us grown-ups, there's got to be some easy recipes you have to incorporate these berries into our diet. How do we do it easy?
Yes, absolutely. I'm all about easy. I'm, a pediatrician, but also a mom of 5.
Oh my.
So I really like easy. So one of the recipes that I love the most that you can find on Spectrum Health Lifestyle Medicine website is a cherry mocha smoothie. So not only does it have cherries, which are a type of berry, but also mocha. So that will really help boost your energy throughout the day, which, like I said, as a mom of 5, this is really important. So that's one of my favorites. There's also several other berry fruit smoothies that are really great for kids. I really like encouraging my kids, to think about why is this food important? And we talk about how many ingredients are in the smoothies that we eat. So that's kind of a fun thing that we can do.
Yeah.
So for adults, smoothie is a great option. Oatmeal with berries on top. Maybe you can make a berry sauce and top it on your pancakes. There's so many great options.
Yeah, and excuse me, in our house, it's always the sliced fresh strawberries on top of the pancakes that Dad makes on the weekends. Now, I reacted, by the way, when you said you were a mother of 5 because I was one of 5. So I know what you're going through. Okay, so.
Yes, that's great.
When it comes to fresh food, obviously, that's great. We know the nutrients are there, but sometimes it's hard to, you keep them in your fridge. They seem to go bad soon. What about frozen or dried berries? Are they just as good nutritionally?
Right. Well, I think especially in this area, this part of Michigan, we have so many great farms that have fruits and vegetables available to us in the spring and summertime, through the fall even. But like you said, during the winter months, it can be really hard to get those fresh, fresh produce, and frozen and dried berries are especially nutritious for us and, as beneficial as their fresh counterparts. So something that my family likes to do is we go to the farms in the spring and summertime and we pick lots of berries like raspberries, blackberries, cherries, strawberries, and we freeze them in a freezer so that we can have even local produce throughout the other seasons. But you can also look for dehydrated vegetables and fruits.
Okay.
My kids especially like freeze-dried strawberries.
Yeah.
Those are really fun.
Yeah.
And then also things like, raisins. Raisins are also a great choice. When looking at those kinds of foods, I try to look for no sugar added and also low or no oil added. That's something else to think about.
Perfect. Yeah, those freeze-dried strawberries are big in our house too. But fruits, vegetables, a plant-based diet that's really catching wind lately. A lot of people talking about how that's having a dramatic effect on their health. Can you talk a little bit more about why people might consider a more plant-based diet?
Yes, absolutely. This is something that we're all really passionate about at Spectrum Health Lifestyle Medicine team. A plant-based diet has been shown through lots of medical research. It's backed by a lot of data that if we follow a more plant-based or plant-forward diet or a plant-predominant diet, if you want to think of it that way, we know that we can help prevent or reduce our risk of 8 of the top 10 killers of most Americans. So that includes things like heart disease. And especially as we're talking about berries this morning, we know that berries are helpful in preventing heart disease or even reversing some of the signs of heart disease. So a plant-based diet is really something that we should all at least aim towards. Like I said, a plant-forward diet or plant-predominant, looking to add more fruits and vegetables every day into our diet.
And I'm sure that you guys offer, the program offers so many educational classes about healthy eating. Can you speak to those?
Yes, absolutely. I'm proud to teach some of those courses as well. We have chefs and dietitians and nutritionists and other staff members that help us teach community classes as well as classes for our medical providers. So we offer classes like how to build a better meal, how to build a burrito bowl, how to make kid-friendly recipes, how to use beans and lentils in recipes. And you can find all of these wonderful course offerings on Spectrum Health's Lifestyle Medicine page. If you go to Culinary Medicine section on that page and then look for the courses, there's a whole listing of the up and coming classes that are offered.
Dr. Dudley, thank you so much for the information. Yeah, I got to up my lentil game, so I'll be heading over there to find some good recipes. We appreciate your time this morning and all the great information. Thank you so much.
Thank you so much.
Absolutely. You want to learn more about this? As you just heard, there's a lot of recipes just waiting for you for free and information. You want to learn more? Spectrum Health's Culinary Medicine program. Just go to spectrumhealth.org. We'll be right back.